Hello friends. Today we are going to discuss about World Mental Health Day 2024. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about World Mental Health Day 2024. What are the objectives of this day? What is my role and your role in fulfilling the objectives of this World Mental Health Day? The World Mental Health Day 2024. The objective of this day is to raise awareness regarding mental illness, mental distress, and promoting mental wellness. And at the same time, by raising awareness, we need to mobilize resources to provide care for persons with mental illness. This is the day it provides opportunity for all the mental health professionals, other stakeholders working in the area of mental health to talk about their work. At the same time, make awareness about the struggle a person with mental illness goes through in their life, and also to decrease stigma and discrimination, which is widely prevalent across the globe. World Mental Health Day is celebrated every year on 10th of October. This day was founded by World Federation for Mental Health, which was started by the members from various countries. It is not from just a single country. The members across the globe came together. Initially, it was 46 countries which came together and founded this World Mental Health Day. This World Federation of Mental Health championed the cause of mental health awareness, fighting stigma and stereotypes around mental health. At this point of time, there are 90 countries, the members who are affiliated to World Federation of Mental Health. This year theme for the World Mental Health Day, it is time to prioritize mental health in workplace. This is very apt considering the post-COVID period. The importance of this mental health in the workplace is no longer can be overlooked. Mental health challenges such as stress, anxiety, burnout has a significant impacts on the employee's performance, job satisfaction, and overall organizational success. If you look at the world literature and also the scientific evidence clearly says that an estimated more than 1 trillion US dollar lost globally because of the productivity due to depression and anxiety per year across the globe. And this study was published in Lancet. Globally, an estimated 12 billion workdays are lost every year because of depression and anxiety at a cost of US dollar of 1 trillion per year cost productivity. 30% of the loss occurs because of the poor mental health at workplace. By prioritizing mental health, the employers can create a supportive work environment that fosters open communication, reduces stigma, and promotes mental health well being. This can be achieved through various initiatives like Mental Health Awareness Program, observing World Mental Health Day, providing access to counseling services to the employers, implementing flexible work arrangements, accommodation, and encouraging work life balance. At the same time, we need to myth busting with regard to mental illness. Many a time, people do not discuss about mental health at workplace. This is a very sad state. We need to discuss about mental health at workplace so that there is an open communication and acceptance. At the same time, we also need to destigmatize regarding if a person has mental illness doesn't mean it is weakness. It is an illness which can occur to anybody. At the same time, having mental health illness means it does not mean that he is a bad employee. He is going through an illness. These kind of myths has to be busted. Many a time at workplace, people believe a person with mental illness means dangerous, violent, or maybe a serial killer. These myths has to be busted because the acceptance and accommodation of persons with mental illness is very essential in this global rights-based era. Organization which prioritize mental health will see reduced absenteeism, low turnover rate, and high employee engagement with the company. Ultimately, addressing mental health in the workplace is not a job, it's not just a moral imperative, but a business necessity that can drive a long-term success and sustainability in any organization. In this regard, World Health Organization has published an important booklet which clearly says World Health Organization Guidelines on Mental Health at Workplace 2022. This book is very specifically for the organizations, for the policymakers, and politicians. If you look at mental health, the definition is very clear. Health is a state of physical, mental, and social well being. With regard to mental health, it is a state of mental well being that enables the people to cope with the stress of life, to realize their abilities to learn well and work well, and to contribute to their communities. That is the definition of mental health. With regard to poor mental health as a negative effect on the person's cognition, behavior, emotion, social and relational well being and functioning, their physical health and their personal identity and well being as related to work will be affected. A person's capacity to participate in work can be consequently impaired through reduction in productivity and performance, reduction in the ability to work safely, difficulty in retaining or gaining work, substance use, alcohol use, suicide, attempted suicide, depression, anxiety, and stress. Similarly, presentism, that means a person with mental illness may come to work, but he will not be able to concentrate and focus on his work. Hence, the productivity will be lost, which has a huge financial cost on any organization. At the same time, absenteeism and staff turnover affects both the worker, employers, and also the productivity. In turn, the economic of the community and the society will be impaired. The impact with regard to mental health has a larger implication. With regard to physical illness, morbidity and mortality increases. With regard to mental health, cognition, thinking process, cognitive ability, emotional wellness, behavior gets impaired. With regard to social well being, intra and interpersonal relationships can be affected. Altogether, with regard to mental health and health, has a serious consequences with regard to organizational output and a society's economy. Now the question is how to prioritize mental health at workplace. You need to understand health and mental health can be seen as a spectrum from wellness to illness. In between, there is something called as distress. On one hand, you can see the person has mental wellness which needs to be promoted. At the same time, we need to prevent mental illness. And whenever there is a stress, the person may go through distress. Hence, there is a huge responsibility on the employer to make sure the people are on the other end of the spectrum, that is, at mental wellness. And we need to support the people who are at mental distress. We need to accommodate the people with mental disorder so that they can contribute to the society. Now, the question is how to plan interventions. Invariably, World Health Organization speaks about prevention and promotion for universal intervention. That means the whole organization has to implement preventive and promotive measures, which are very cost effective. At the same time, high risk intervention to the people who are at risk of developing mental illness. That may be considered as high risk people or distressed people. And finally, the people who are indicated, that means the people who are suffering from mental illness, need to be focused also. That means we have three layers of intervention which need to be implemented at workplace. If you look at the universal intervention, that means the whole organization has to implement this preventive and promotive measures. Let's understand about this universal intervention. It can be mental health wellness, yoga, meditation, mental health hygiene, awareness on mental illness and wellness, mental health promotion, emotional quotient training, soft skills training, gender sensitization, prevention of sexual harassment at workplace, decreasing bullying, spirituality, family mental health awareness, socializing activities, and also physical environment at the workplace need to be made safe. If you look at the high risk group, what is the intervention is required here? The high risk intervention are those people who have stress, who have life events recently, family burden, single parent, person with disability, a person who is having chronic medical condition, family history of mental illness and disability, and also the person who is caring for the senior citizen at home who may be suffering from diabetes, stress, or maybe even stroke. Family history of mental illness, marital discord, separated, divorced, sexual minority, gender minority, LGBTQ, and also the high risk job such as healthcare professionals, police, army, hospitality industry. These are the people who are at high risk can develop mental illness in the long run. Hence, the organization CEO has an important role to play. Providing counseling services, it should be from the third party so that confidentiality is well maintained. At the same time, the employee feels safe accessing these resources. Periodic screening and support of the people who are working, accommodation from the flexi timing, work from home, stress management, and also timeout policy if a person is going through a stress and life events, liberal leave policy, social and economic support, supporting children and senior citizen of the workforce, health insurance coverage, debriefing services, especially in certain jobs such as army and healthcare professionals. After knowing about the two important layers, now we will move to the indicated intervention. These are the people who are suffering from mental illness. We need to support the workers who are going through this mental illness. At the same time, we need to have accommodation, make sure they are accessing the services on medication. There is a greater amount of awareness is required in the top management so they are accommodated at the workplace. Otherwise, they are stigmatized, discriminated, and thrown out of the job. The person with mental illness requires high amount of support. Many a time, this accommodation plays a crucial role not only for person with mental illness and also for their family members. We need to involve the family members in the treatment process. This is very common in Asian countries. We need not follow the Western countries where they are highly individualistic, rights based, and no family members get involved in the treatment. But however, in a country like India, Sri Lanka, the family plays a crucial role. Hence, involving family members improves compliance, follow up, decreases stigma, accommodation, play a crucial role. At the same time, we need to make the environment friendly towards persons with mental illness. We need to support them in rehabilitation. We need to accommodate them at the workplace, change of work environment, and giving lighter job when they recover from mental illness and rejoin back to the job. The organizational interventions, that means the organization should consider recruiting persons with mental illness. After the Right to Persons with Disability Act, there is a reservation for person with mental illness. Hence, we need to accommodate them, welcome them, and support them. If they develop during the job, the mental illness which occurs during the job should be given leave, help them for recovering and rehabilitating. That means these kind of accommodative measures during recruitment and if they develop mental illness during the job need to be supported. Now let's look into the evidence-based recommendations which WHO talks about. Here, they have given various recommendations and those recommendations will be considered here. First and the foremost, universal organizational intervention. Here, various psychosocial interventions are done. Preventive and promotive measures are done. The recommendations are conditional and the evidence is low. Similarly, organizational interventions for health and humanitarian emergency workers. These are the people who work in hospitals, disaster relief workers. Again, the recommendation is conditional and very low in evidence. Organizational intervention for work with mental health conditions. A person who has mental illness. The support required a strong recommendation is given, but however, the certainty of evidence is low. With regard to managers training for mental health, that means CEOs and various other health, the person who are sitting in the top of an organization, we need to train them. There is a strong recommendation from the WHO, but however, the evidence is moderate. Further, the managers training, even in the emergency relief workers, the recommendation is strong and evidence is backed by moderate support. With regard to training for healthcare workers and other workers, with regard to mental awareness, here the recommendation is conditional and very low certainty of evidence. Finally, training of healthcare humanitarian emergency workers in mental health has a conditional recommendation and very low certainty of evidence. If you look at the recommendation for individual intervention, again, here the universal individual intervention has a conditional recommendation and low certainty of evidence. It can be stress management, various other individual management. Similarly, leisure based physical activity such as resistance training, strength training, again the conditional recommendation and very low support system or support or evidence. Individual interventions for health, humanitarian, and emergency workers. Again, the individual intervention has conditional recommendation and low certainty of evidence. Finally, the individual intervention for workers with emotional distress. Conditional recommendation is there and very low certainty evidence is present with regard to the evidence. For the people who have mental illness and they are slowly recovering and they are returning back to the work, what is the evidence? Here again, the conditional recommendation and very low certainty of evidence is present for those people who come back to work. With regard to a person who is having mental illness and he is getting recruited to a job, in this, the recommendation is very strong. At the same time, low certainty of evidence. The WHO is very clear. Recovery oriented strategies, enhancing vocational and economic inclusion is very essential. And we need to understand this. And finally, should we do screening program with regard to this? Whether an employee continues to have illness, does not have illness, whether the screening has to be done. In this regard, WHO is very silent. It does not have any studies to back up whether the screening is to be done or not. Hence, it is silent about this. To summarize the WHO recommendation, it has three different types of the intervention which has talked about: mental health promotions, prevention of mental health condition, and supporting the workers with emotional distress. Let's look into each one of them. If you look at mental health promotion, it has to be done when a person is gaining employment, returning back to work after mental illness, the person who is having mental illness, selective and universal. With regard to prevention of mental health condition, this should be done in a person who has mental illness in the past and is on medication. And the people who are at high risk, and also universal implementation has to be done. For the people supporting the workers with emotional distress, for those people gaining employment, for that again there is a important induction program has to be done. A person who is coming back to work after mental illness need to be supported, and the people who are having illness need to be supported. To conclude, my dear friends, return on investment is very high when we invest in mental health at workplace. Mental health should not be left alone to the mental health professionals. It is the job of every citizen, every employee and employer. So, we need to support a person with mental illness, make sure mental health is given priority at workplace. Hence, every organization need to have policy for mental health at workplace. And every country should have mental health policy at workplace. There are simple techniques one should know if you're a manager or a team leader when you're working together. Of course, even if you're a doctor or a nurse and there are people working under you, or else even the patients. In such a scenario, you need to know about the simple techniques. First, connect face to face with the people who are working under you. Promote the work life balance and also at the same time socialize outside the work hours. Offer mental health perks. Encourage mental health days and leave. Encourage physical activity during the workday. Ensure proper resource allocation and have dedicated human resources so that the stress is taken care. To conclude, my dear friends, we need to keep the communication open. There should be a culture for protecting, promoting mental wellness at workplace. Flexible work arrangements, work from home, and role confusion, role overload, conflict, and ambiguity needs to be addressed at the earliest. We need to address stress, burnout, and overwork so that the employer and the employee relation continues for long duration. Enhance mental health support and benefits. Train managers and leaders with regard to mental health and mental illness. And there should be a regular feedback from all the stakeholders so that we can prioritize mental health at workplace. So, my dear friends, this year theme on World Mental Health Day is prioritizing mental health in the workplace. Thank you very much for giving your valuable time. Stay safe.